Good morning and welcome to this session. First of all, I have to change my glasses. I apologize. This morning we're going to hear from two speakers in addition to me. First, Anthony Signorelli, who is the Vice President and Campaign Director at the Advertising Council. Mr. Signorelli leads the strategic development, creation, and evaluation of numerous multimedia advertising and cause marketing campaigns, including initiatives for the U.S. Department of Health and Human Services, USDA, the Office of the First Lady, Feeding America, the U.S. Olympic Committee, and the American Heart Association. He's a frequent speaker on panels about advertising practices. And our second speaker will be Lori Dorfman, who directs the Berkeley Media Studies Group, a project of the Public Health Institute where she oversees BMSG's research, media advocacy, training, and strategic consultation for public health advocates, as well as professional education for journalists. With colleagues at the Center for Digital Democracy, Dr. Dorfman has been conducting research on how food and beverage companies are using digital marketing to target children and adolescents. Also, with colleagues at the Center for Science and the Public Interest, she co-convenes the Food Marketing Work Group, a national network of organizations and experts who are concerned about the proliferation of marketing of unhealthful foods and beverages that target children and youth. And they will speak after I make some opening remarks. So where are we? Okay. This is a topic that we're going to be taking up today, but I want to point out and hold up for you a recent publication from IOM on challenges and opportunities for change in food marketing to children and youth. This report came out of a workshop that was held here in November of 2012, and it's available for a free download at the National Academy of Sciences site. So this is a continuation and an evaluation of how we're doing in the food marketing environment, specifically looking at equity issues. The goal is to try to transform messages about physical activity and nutrition. And the fact is that we are surrounded by messages through a variety of advertising delivery systems, both digital and traditional media, in restaurants, on food packaging, in retail stores, and that these messages, more often than not, are promoting unhealthy choices, and what we would like to see is the promotion of more healthy choices. Why is food marketing of such concern, particularly when we talk about children and youth? Well, we have evidence from the 2006 study on food marketing, which surveyed and analyzed over 200 studies, that television advertising influences the food and beverage preferences, purchase requests, and short-term eating habits of 2 to 11-year-old children, and that TV food advertising exposure is associated with body fatness in children ages 2 to 18. So what we do know is that advertising works and the kinds of messages that children receive are influential. The message environment recommendations that we want to make is that we need to act much more aggressively and in a sustained manner on many levels to transform the current message environment. Today's reality is that the most frequently marketed foods and beverages are high in fats, sugars, and salt. Many health-related social marketing programs are underfunded, inadequately designed and tested, or not sustained long enough to have an effect with adequate support. And so any future marketing campaigns have to take these issues into account. Consumers also are confused by many of the front-of-package nutrition rating systems currently in use, which have been multiplying and aren't necessarily consistent with each other. And consumers, we know, cannot easily evaluate the healthfulness of a lot of restaurant menus. The APOP report recommends engaging in several messaging strategies. Strategy 1. To develop and support a sustained and targeted physical activity and nutrition social marketing program. The recommendation is that Congress, the administration, and other federal policymakers and foundations should dedicate substantial funding and support to the development and implementation of a robust and sustained social marketing program on physical activity and nutrition. That these messages should be specific, they should be culturally appropriate, and they should be related to the change goals that we're seeking to improve the physical environment and to increase availability of healthy foods, for instance. Secondly, the recommendation is that the food, beverage, restaurant, and media industry should take broad, common, and urgent voluntary action to make substantial improvements in their marketing aimed directly at children and adolescents aged 2 to 17. All the foods and beverages that are marketed to children should meet the dietary recommendations of the dietary guidelines for Americans. Children and adolescents through these campaigns should be encouraged to avoid calories from foods they generally overconsume, such as products high in sugar, fat, and salt. And it should encourage them to consume more of those products that they underconsume, things that include whole grains, fruits, and vegetables. The standards set for these food and beverages marketed to children and adolescents should be widely publicized so that children, adolescents, and their parents are aware of them. And they should apply to a broad range of marketing vehicles, the digital world as well as the more traditional media. Most importantly, it's the recommendation from the APOP committee that if such marketing standards have not been adopted within 2 years by a substantial majority of food, beverage, restaurant, and media companies that market food and beverages to children and adolescents, then policymakers at the local, state, and federal level should consider setting mandatory nutritional standards for marketing to this age group. Strategy 3. The recommendation is that the Food and Drug Administration and the USDA should implement a standard system of nutritional labeling for front of packages and retail store shelves that's harmonious with the Nutrition Facts Panel and which is simple and easy to understand. Strategy 4, that the USDA should update the policies for the Supplemental Nutrition Assistance Program Education, SNAP-Ed, and we heard from Tracy Fox yesterday that SNAP-Ed is very much in danger in the current agriculture bill. But we were recommending that the USDA should update their policies and to explicitly encourage the provision of advice about types of foods to reduce in the diet for their families. Now, meeting these challenges is going to be difficult. We've heard yesterday, and we'll hear more today, that accelerating obesity prevention includes accelerating progress in reducing the disparities, and that will not be an easy job. And the disparities in this area of food marketing are substantial. Let me highlight some of the evidence that we have. Physical activity environments are key settings for accelerating obesity prevention, but opportunities for safe and affordable leisure time, as we heard yesterday, are less available in racial, ethnic, minority, and low-income communities. Second, the lowest cost foods and beverages may often be the least healthy and the highest in calories, which means that people with low incomes may need to rely on these foods to a much greater extent than people with higher incomes. Third, message environments in many ethnic, minority, and low-income communities are dominated by advertisements and other promotions of high-calorie foods and beverages generally in stores, around stores, and on billboards to a significantly greater extent than applies to predominantly white or higher-income communities. Further, Black and Latino children and low-income children rely heavily on television and electronic media as sources of entertainment and are exposed disproportionately to ads for high-calorie foods and beverages through these sources. Moreover, TV ads on shows watched by Black audiences have more food ads, and these ads are for unhealthy foods. Lastly, the mix of foods available in low-income communities presents a plethora of high-calorie options, marketing in quantities and at prices, and even in culturally tailored ways that are very attractive to these community residents. Sometimes, these are the only convenient options that they have. In short, the marketing and message environment needs to change in order to accelerate and to achieve equity. With those comments, I'd like to invite Anthony to come up and make his comments.